Hello guys, welcome to my channel David Hacks. Today our video is about complete guide to the American healthcare system, the types of health insurance and coverage options for the immigrant and experts. How does the US health system works? Healthcare in the United States is organized in a complex bureaucracy, while in the rest of the world healthcare facilities are owned mostly by governments or by private sectors business. In the US, a large share of hospitals and clinics are owned by private non-profit organizations. The United States is a country that has the highest healthcare expenditures in the world. While those expenditures are covered in a large share by public payers, as by federal instruction or state and local governments, they can also be covered by private insurance and individual payments. At the same time, unlike most developed nations, the US health system does not provide health care to its entire population. As there is no single nor a nationwide system of health insurance, the United States primarily relies on employers who voluntarily provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover healthcare expenses for the fragile parts of the society as the elderly, disabled, and the poor. These programs differ from one another and all have a specific kind of people that are subject to. Getting health insurance in the US is not an easy thing. Someone may think that once you have money, everything is easy peasy. But in fact, there is a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance in the United States for non-citizens. The United States government does not provide health insurance for all its peoples, and health insurance is not obligatory for those living in the USA. It is optional but highly recommended, and necessary science health services are very costly, more than in any other country anywhere across the globe. There are two types of health insurance in the US: private and public. Most people USA use combination of the both. The US public health insurance are medicine, Medicaid, and children's health insurance program. The US has the most expensive healthcare in the world. That's why getting adequate health insurance coverage comes highly recommended. Medicare is a national health insurance program that dates back to 1996. It provides health insurance for U.S. nationals older than 65 years old, but also for younger people with end-stage renal disease (ALS) and some other disabilities. And data show that in 2018, Medicare provided almost 60 million individuals with health care in the U.S. Over 51 million of which were older than 65. The Medicare program is divided into four parts. Part A, which covers hospital skilled nursing and hospice service. Part B covers outpatient services, including some provider services with inpatient in the hospital, outpatient hospital charges. Today our video is about that. If you like my video, then please subscribe my channel. In other video, we will discuss about Medicaid and Children Health Care Insurance Program.